Hi everyone, my name is Beam. Welcome to this channel. In this video, I'm going to share with you some of my experience and tips on the planning of new OSCE. The new OSCE sometimes can be quite tricky. They've got a specific format, and if you want to pass it, you have to follow that specific format. So basically, planning means care plan. It means in this session, we are going to write 2 care plans. When your exam starts, then you will see that in your planning session, you will see a scenario like this. So remember to put your candidate name here, because you don't want to visit their assessment and planning together just because you forgot to put your name here. And then you will see a scenario like this. It will give you some information about what happened to the patient now. Sometimes maybe in your assessment the patient is pre-operative. She just attended the emergency department because of pain. But in planning session, maybe she already finished with the surgery. But they may still ask you to write a pre-op care plan. So you have to pay attention to here. So here will give you the information what type of care plan they expect you to write. Maybe they will ask you to please produce a pre-operative nursing care plan, or maybe it's a post-operative care plan. So remember, spend time to really read the scenario, because otherwise you will fail your planning because you make an inappropriate or unrelated care plan. Then after you turn to the next page, you will find a form like this. Usually the patient details already filled for you. Then what you have to do is to fill the nursing program, aim of care, the evaluation time frame, and also your nursing intervention, and also sign the document after you finish it. So for nursing program, maybe let's use pain as an example. So I will put H is experiencing pain with evidence by pain score 8/10. Remember, you have to put the patient name in your whole care plan. Don't just put patient is experiencing pain. Don't do that. And then because you have to make it evidence-based, which is emphasized in the new OSCE. So that's why you have to really find an evidence to prove yourself. So that's why I put with evidence by pain score 8/10. Then of course 8/10 is like severe pain, so it means it is really the patient's actual problem. And then for the aim of care, I will put Ash will verbalize her pain is manageable with a pain score 2/10. For your aim, you have to write it in a SMART format. It means you have to be specific, measurable, achievable, realistic, and timely, or with a time frame. So here, I put pain score 2, so it's measurable because pain is something measurable, and pain is also specific, because if just put condition, or maybe you put like her condition will be improved, that is not specific. And then next with the re-evaluation time frame. So the patient will be reassessed today and 30 minutes after medication or condition change. And later we'll talk more about that. So I will just skip this part at this moment. And then for nursing interventions, we have to use specific format. So what does this word mean? It means explain, monitor, assess, teach, administer, referral, and document. So how to apply this into your nursing intervention? It's like this. So first, explain the treatment plan to Ash and gain her consent prior to all procedure. I think this one is just universal. It's applied to all type of nursing problem because we need to gain consent and also explain to our patient no matter what it is. And then from this, so with monitor, I will monitor her condition every 4 to 6 hours according to National Early Assessment Score. So this time will give you a time frame, and this time frame is actually it's based on the new score you calculated in your assessment part. So if you calculated the pain score is more than 5, then don't put 4 to 6 hours here. And then how do you assess pain? So I assess her pain using Universal Pain Assessment Tool or Numeric Pain Assessment Scores. So I think both also alright. And then what are you going to teach her? Maybe some deep breathing exercise, some distraction method. And then of course we have to administer analgesic to her. And then remember to put the word as prescribed, because we can only give the medication as a nurse. We can only give it when it's prescribed. We cannot just randomly give medication to people. And then referral, and I will put escalate to her doctor if the pain is still uncontrollable with medication, because it's post-operative or maybe it's post-P, or maybe the patient have a ruptured appendicitis or fracture. Then of course she's in pain, and so maybe maybe refer her to a pain team. Maybe it's not so appropriate for this moment. But I think if it's like chronic pain or it's cancer pain, then it's still uncontrollable. Of course you can refer her to a pain team. And then last, document all care provided to her. This also universal to all types of care plan. And of course, on top of that, if you can think of anything, then you can also add to it. But basically, if you included everything, all the wordings, explain, monitor, assess, teach, administer, escalate, referral, and documents, then probably you will be able to pass it. But just if you unfortunately forgot about assess or monitor, then you may fail it because of irrelevant or not evidence-based. Then of course, remember to put your name and signature and date here. Okay, so next we will try community setting. So I will put Ash is at risk of malnutrition with a MOS score 2. So 2 means it's a real problem, and then you have to really escalate it. Okay, what's your aim? I will put Ash will achieve adequate nutrition showing an acceptable weight or BMI. Or you can use MOS score because we have to do it in smart format. So MOS score is something that measurable. And also the time frame, I will put reassess today or at next nurse visit in 7 days, or if condition change, because it's a community setting. So that's when then for these 7 days, usually you will find it in your scenario on the first page. So it will tell you have to write a care plan for next 24 hours or next 7 days. And then I will put, first using the OSCE format, where I will put explain the care plan to Ash and gain her consent prior to all procedure, and then assess her nutrition stage using MOS. I think apart from what, we don't have other assessment tools here for nutrition. And monitor her condition, maybe using food diary and BMI in every visit. and educate her about some nutritious food choice, provide information on food that rich in vitamins and minerals. And we don't administer medication here, but we can administer some food supplement as suggested by the dietitian. And then here, remember, refer her to a dietitian as policy. We won't escalate to doctor or refer her to other healthcare professional, just dietitian, because in the policy, if the patient must score with 2, then we have to refer her to dietitian. And then finally, document all care provided to her. And last but not least, remember to sign here as well, because you have to sign for both care parents. Okay, so now I will talk about some common nursing problem, maybe breathing difficulty, pain, fall, anxiety, infection, and then with a patient with maybe a high PHQ nurse score, then he or she may be at risk of self-harm, sleeping problem, injury, patient may at risk of injury. Then if the patient got dementia and with a high 60 score, so it shows that she has severe impaired cognitive ability. And for decreased GCS, then the patient may be at risk of deterioration, because decreased GCS can actually mean the patient having intracranial hemorrhage or stroke. Then we have to closely monitor the patient and escalate her condition once we know that there will be a risk of deterioration. And then for muscle, then we will have malnutrition. But sometimes maybe the patient may verbalize it to you, and maybe you do it by your observation. Then the patient may also be malnutrition as well. And then of course they may be spiritual need, especially if the patient is experiencing end of life, and then he or she verbalized about that. Okay, then we will move to the next page. This is how to write an evidence-based nursing problem. So the formula is first put the patient name, and then you can use, if the patient is really having this problem already, then just put is experiencing or is having, or maybe actually it's just a potential problem. Oh, that patient may have a fall risk because she with impaired mobility. Then I will put the patient is at risk instead of is experiencing. And then we will put what her problem is. So just like we discussed it in the previous slide, maybe the patient is having breathing difficulty, maybe the patient is in pain. Okay, but you have to be evidence-based, so you will put in view of or as evident by, and then you put your reason. So your reason can be a score, an assessment too, and then also it can be because of something happened to the patient, like maybe he or she just underwent surgery, or he or she got surgical wound, so that's why he or she is at risk of infection. Does it make sense? Okay, now we use this format to create nursing problem. Then I will put first patient name, Ash, and it's an actual problem, so I put is having, and then what's the problem? Is the patient is having impaired cognitive ability. Why I say that the patients have impaired cognitive ability is because, as evident by the 60 scores show that's 24/28. Is it alright? Okay, now we move to the next page. It's about our aim. So, as I mentioned before, SMART format means S mean specific, M mean measurable, A mean achievable, R mean realistic, time mean timely. So what does this 5 words mean? So basically specific, it means you really have to focus on one thing. So you won't put, oh, Ash's cognitive ability and pain and her condition. No, you will focus on one thing. And measurable, of course, you have to measure, maybe using some scoring or numbers if possible. And achievable, so just like if a patient, he or she got intracranial hemorrhage or brain tumor, and it caused her or he or she now having problem with altered GCS, with GCS maybe 8/15. Is it possible that he or she suddenly return to full GCS 15/15 without removing the tumor or without removing the blood clot? Or sometimes actually even if you remove the blood clot or tumor, the patient still unable to return to full GCS. So it means actually it's a little bit unachievable. So, and then maybe that's the reason why some people in their aim, their feedback will be the aim is not realistic or not relevant or something like that. Yeah, okay, the next one is, yeah, similar to achievable, it means realistic. We have to really realistic. And then timely. Timely means this problem should be his or her actual problem at this moment. I mean, you cannot like, okay, so the patient is maybe in pain now, but then you put, oh, the patient may be at risk of develop depression like 10 years later because she is in pain now. We won't do that in her care plan. We have to be timely, focus on this moment. Alright? Okay, then move to the next part. It's about time frame. So basically, we put today and then add the monitor frequency and then add the word that's very important at this phase, if condition change. Remember, every time, even though maybe, okay, is you put every 4 hours and then, oh, I just took the vital sign 1 hour before, but the patient now, she complain of severe dizziness. So it means if condition change, so you still have to assess her and then check her vital signs. Don't just, oh, it's every 4 hours, so okay, I will check your vital signs 3 hours later. No, don't do that. Check the vital signs if the patient condition changed. Okay, so for the patient with altered GCS, we will the time frame, the monitor frequency should be every 30 minutes until full or stabilized in the coming 24 hours or in this 12-hour shift. And then add the sentence, or if condition change. Of course, if you suddenly find that the patient is just unresponsive, then of course you will check the GCS again, even though maybe you just did it like 5 minutes before. And then news score, every 4 to 6 hours according to news in the coming 24 hours or in this 12-hour shift, or if condition change. Then of course if you got a very high news score, then you put and then you put according to the scoring. Or even though maybe if you got 0, then will you put, oh man, every 12 hours? No, because if the patient just newly admitted to the hospital, we have to check his or her vital signs every 4 hours. Or maybe you can put, okay, I will check his or her every vital sign every 4 hours because the patient just newly admitted to hospital. You can just explain it maybe a little bit more to the assessor. And then if you give medication to the patient, then put 30 minutes or 1 hour after medication. Maybe it's analgesic, maybe it's antidepressant. Because if the patient is pain, then we have to look for the effectiveness of the medication. And then if the patient just came back from operation theater, then check her vital signs every 15 minutes in the first hour, and then every 30 minutes in the second hour, and hourly for the next 4 hours. And for community, the next review day will be the next visit. And of course, we also have to add if condition change. Of course, if the patient call you that, oh, I feel I'm more depressed and I have more self-harm idea today, then of course we will assess her, even though it's not yet 7 days. Alright, so basically about OSCE planning is like that. So thank you very much for watching this video. Hope you enjoyed this video. If you like this video, please like or subscribe to this channel. Thank you very much. Good luck to your exam. Bye.